So what are the qualities needed for efficiency? I'd like to share with you that it is not so much of how many resources you have, but is how you use the resources you have. So I've listed a number of things we need to consider. One is self-awareness and discipline, good leadership skills, resilience, innovation. You have to have good communication skills to be able to put your team together. One important thing we need to learn or have learned is to recognize that business is not the same. This is a serious crisis. This virus is lethal. We must recognize that and work towards defeating it. So as good leaders and good practitioners, you recognize that a change has happened. But more importantly, we have to be sensitive to what directions we are getting from the World Health Organization, public health agencies, and all the guidelines that the government's policymakers are putting forward, helping to contain this pandemic. And what do? Counsel our patients. So these qualities come on as actions. We have to be adaptable to change. We have to be available for our patients and our communities. We have to be flexible. We have to be collaborative with our partners and stakeholders. But more importantly, good listeners and resilient. Over the years, we have worked on virtual care, and we find some avenues of collaboration with our colleagues, our stakeholders, our patients to make a successful outcome. So in terms of virtual care or telemedicine consultation, what are the services that are non-COVID that can be provided? These include new or initial patient referral, follow-up appointments, counseling, multidisciplinary groups, and pre-admission, discharge planning, all sorts of things that can be done, services that can be provided virtually. I'd like to share with you 3 cases that bring to us realization of what virtual care can do. Case 1 involves an 80-year-old man with a blocked catheter in a little village, northern Ontario. He had constipation. He went to the health center. The health center was 30 kilometers away, or 30 minutes away from the nearest hospital, and 2.5 hours away from the nearest urologist, and 7 hours by drive to a urologist that does telemedicine. So the first instance for the nurse was to call the cell phone of the urologist. I went away, got a response. The urologist responded by telephone, attended to the patient. Patient was catheterized for over several cc's of urine, and then given a trial of voiding. And 6 hours later, the urologist called back to verify how the patient was doing, found the patient was back into retention. He gave instructions and directives. Patient was catheterized for 1,700 cc's of residual urine, made comfortable, discharged home. The next day, the urologist and the nurse were able to set up an audio and a video conference by telemedicine to assess the patient. And that more or less resolved that acute episode of urinary retention in an 80-year-old man not requiring any hospitalization, not requiring air ambulance transfer, nor requiring long-distance driving to get care. That's just one of the examples of what virtual care can do.